Scapular pathology is even one of the more interesting aspects, and one of the things that I think is fascinating with this technology. So when you look at this, you can actually see how the scapula moves. And in a normal shoulder on the left, you can see that the scapula externally rotates, as we all know, around the body, and contributes a fair amount to that overall shoulder motion. But on the on the right, you can see how there's very little scapular motion. And despite the patient having basically full glenohumeral motion, their scapula is in essence paralyzed. So this is a patient with serratus anterior palsy. Here's another example, a 21-year-old swimmer, limitation in shoulder function, no prior injury, collegiate swimmer, but very limited shoulder function. He woke up one day and couldn't move his shoulder. No prior injury, nothing else really to explain this. You can see his examination. He has scapular winging. This is the normal shoulder, so I'm testing the strength of his serratus anterior on the left. He has really good serratus anterior strength. See, when we go to the right, though, look at how much he wings out. So he has no actual serratus anterior function, so it means no ability to hold his scapula to his chest wall. This markedly limits his ability to function, especially as a competitive athlete like a swimmer. And up until now, it's a clinical diagnosis. But as you'll see in a second on his DDR, you can actually make this as a more objective thing. This is me stabilizing his scapula, and you can see I'm able to correct a lot of his glenohumeral motion by just keeping his scapula against his chest wall. So here's his DDR. So you can see how limited his scapula actually is moving. So his glenohumeral joint almost has full motion, but he has very limited scapular-thoracic motion. That's because the serratus anterior is not holding his scapula against his chest wall, and he doesn't have the normal external rotation that most of us would be accustomed to. You can see how much more information you get on the right compared to just a static image on the left, which looks like, at least from my perspective, a very normal shoulder. Here are two other patients, also with scapular pathology, both with serratus anterior pathologies, paralysis as well. And once again, you can see how there is basically no scapular external rotation with either of these patients. So it's very limited in how much they can actually use their scapula, and thus it's very limited how much they can actually use their shoulder.